We know greater access to testing is an important tool to identify the true scope of this outbreak in Ohio, and now the state is clearing the way for you to get a coronavirus test at one of thousands of pharmacies statewide. 5 on your side investigator Joe Paganakis is digging into that proposal. Joe, is the Ohio Pharmacists Association on board with this idea?
Absolutely, Rob. They're in favor of it. They say it would take pressure off of a Northeast Ohio healthcare system that is getting ready for a tidal wave of coronavirus cases.
Right now, the system can process approximately 200 tests per day.
Ohio's governor outlines the urgent need to ramp up COVID-19 testing to at least 1,000 tests per day statewide.
90% of the population lives within about 2 miles of some kind of a pharmacy.
And now the Buckeye Institute pushing this proposal to allow many of the state's 15,000 pharmacists to conduct on-site testing for flu and strep and even eventually COVID-19.
This is all about relieving the stress at the places where we know we're going to be seeing so many more people going because of the coronavirus.
It's not meant to replace a doctor-patient relationship. It's meant to complement it. Much like patients can come into a pharmacy today and get a vaccine.
The Ohio Pharmacists Association is in favor of the idea as long as pharmacists have access to personal protective equipment. The association says the drive-through testing proposal would cover flu and strep, but could be extended to cover COVID-19 testing in the coming months with proper training.
A lot of pharmacies have moved to drive-through only or curbside pickup. This would also be something that a patient could do curbside as well if pharmacists were to come out.
And the Buckeye Institute has sent its proposal directly to Ohio Governor Mike DeWine and Health Director Amy Acton. Florida just approving a similar measure, allowing pharmacists to perform on-site flu and strep tests.
The surge is coming. We see the numbers, of course, unfortunately going up. So we want to be able to do as much as we can, as early as we can, to make it easier.
And Rob, the Buckeye Institute says that COVID testing could allow pharmacists to do those tests on a temporary basis with a simple governor's order. A more permanent law would have to be approved by the state legislature.
All right, Joe, sounds good, but it can't be the end here. How else is the state working to increase this testing?
Well, this order that just came down is calling on hospitals and urgent cares and surgery centers not performing surgeries to quickly start with COVID-19 testing, Rob, as soon as possible. These are uncertain times.